Salt reduction has become really a very visible problem nowadays, partly because there is a change in the patterns of consumption. Previously, the people were having the nutritional habits, they were cooking at home, they could control the amount of salt they were adding in their food. And nowadays, because of the globalization, because of the economic development and all these other issues, the people are consuming much more outside of the house, or they are buying in the supermarkets the semi-processed food or some, half ready-made products or ready-made products. Over there, it's as the food industry uses salt as one of the, of course, additives in their products, it's very hard to control the level of salt that somebody is consuming. So that makes the consumption of salt so-called uncontrolled. I can say we are consuming too much of the salt that's been hidden, so we don't know where it comes from. And because of that, the level of consumption in the world, as well as in our continent, has risen. It's almost a double, or sometimes it's even a triple in the Caribbean, of the recommended amount of 5 grams of salt per person per day. The 5 grams per salt per person is actually 1 teaspoon of salt. So you can imagine how little it is and how much the people actually lose control over that amount when they consume salt outside or consume products outside of the house. And so when I was studying medicine, which was like 30 years ago, the main advice regarding salt consumption was related to the people who were with hypertension, because they were the ones that had the problem of really avoiding the products that were high in salt. Nowadays, because of all this, let's say, lost control in consumption of salt, this is something that we have now to implement to overall population. So nowadays we have to look how much salt the child consumes as much as an adult healthy person. And that is why we are trying to spread the type of the messages which are for the general population, and they are talking about eating as much as possible a lot of fresh fruits and vegetables, taking care that when we are cooking we add more the herbs and other tastes that are helping and not the salt. Also eating less outside of the house, or when you are eating outside of the house, then look how much sodium are in those ready-made products. So it's not a simple task to actually go down to 5 grams a day, because if we look at the recent data that came out from, let's say, Brazil, they are consuming over 11 grams per person per day. Argentina has official numbers about 13 grams. Chile is at 9.7. Some older figures from the Caribbean tell us that in Trinidad it's over 15 grams. So, it's really a very, very high consumption of sodium in our region. So PAHO has been concerned about that, and since 2009 we have been with an initiative that is population-based salt reduction as a part of the prevention of cardiovascular diseases in our region. Sodium reduction is seen as the most cost-effective way of preventing hypertension as well as chronic non-communicable diseases. It is one of the WHO so-called best buys, and we are really now with sufficient evidence that it's necessary to do that, and we are with a lot of tools and recommendations that our organization is having to help not just the general population as well as health professionals to pay attention on that. This year is the World Health Day is dedicated to hypertension. That is the reason why we are also talking about salt and salt consumption, because it's a population-based approach to prevent hypertension. And our organization is going to emphasize that on the celebration, on the panel that's happened on the 5th of April in our organization, as well as it's going to continue talking about salt reduction on the 17th of May, which is International Day of Hypertension, as well as in September on the World Heart Day. I can say that there is practically no other better way of preventing hypertension of chronic diseases as cost-effective is practically reducing salt intake. This week is from 11th to 15th of March is the week of salt awareness. So we are celebrating this week with a lot of activities. We are using our social media. We are having a webinar that is gonna talk about, eat less salt. And this year, actually, World Action of Salt, that is celebrating this week, is talking much more with the chefs. It's talking with the people who are influencing our cooking habits, and they are mobilizing the chefs throughout the world that are well known, and they're having their TV programs to take care and do not add too much salt in their recipes. So that's why it's called Less Salt, Please. And we are also having a small project that is looking at the level of salt in soups. So that's happening in 8 countries in our region, and we hope to have the results to present them in our webinar.